Welcome back, guys. Today we are going to see the nursing management. This one is the general nursing management. Then you write your name to this. And then we come to assessment. And then under assessment, we have history taking. Where we'll take the age, the name, and the patient's problem. What is exactly what's wrong with the patient? And then we'll do our physical examination from head to toe. And then if you have done our physical examination, we are going to admit this person. We are going to admit the person. Where are we going to admit? Depending on our assessment. So, you can decide to admit in isolation, in the ward, that is male or female ward, surgical ward, also depending of the condition of the patients. And now the condition of the room also should be clean, well ventilated, and having sufficient light. So now, what are you going to write in the examination if they have brought this question? So, I admit the patient in ward where it is clean, well ventilated, and having sufficient light. And then, we are going to position this patient. And in position, it depends on the condition of the patient. If the patient has cardiac problem, you will put on the cardiac bed. Also difficulty in breathing, all those ones. If the patient is unconscious, recovery position. But remember, you need to be changing the patient. All the position, if someone stayed long in that position, it will become uncomfortable. So, you put the patient in the comfortable position. We are going to reassure this person. If the person can talk, you can reassure the patient. But if the patient is unconscious, you reassure the attendants. Any small condition for any patient, the patient need to be reassured and need to be given that hope that he or she can get healed from the condition he or she has. To allay someone's anxiety. After reassurance, we are going to do our observation. We are going to do vitals. And those vital observations are temperature, we are going to do blood pressure, we are going to do pulse, rate, rhythm, all those ones. And then we are going to do respiration. We are going to do investigation. Then under investigation, we are going to do CBC, RBS, random blood sugar, we are going to do urinalysis. Any investigation which fits the condition which you have been given, you can do it, you can write it under investigation. And then, after investigation, the result will come, the doctor will prescribe the drugs. The next step is we are going to give medication. So we are going to give medication as prescribed by the doctor. The next step, we will go to nutrition. Nutrition. So, under nutrition, remember you can take drugs, you need to eat. Whether you are unconscious, you need some food, glucose, for the maintenance of the body. And under nutrition, depending on the condition, like those who are having hypertension, restrict salt, and those who are having diabetes, sugar, reduce. So under nutrition, you are going to advise or give the food according to the condition of the patient. If someone is malnourished, you know also the food which is needed for the baby or for the person, isn't it? So under nutrition, you just give well-balanced diet. So if you don't know what to do here, just say give well-balanced diet. Anything which is taken in the body have to come out. Then after nutrition, we are going to go to elimination. So I've forgotten something under nutrition. Also, don't forget water. Take plenty of water. This one will help to neutralize some toxins from the body, most especially the drug, which will be eliminated through the urine. So then after we come to elimination. Those eliminations are feces, urine, vomiters. See? So now, what are we going to monitor here? We are going to monitor the fluid intake and output using the fluid balance chart. And then we are going to monitor the bowel movement. Those ones are stool and vomiters. So under fluid, how much water has the patient taken, juice, any fluid thing the patient has taken in, and then we monitor through the urine. If maybe someone is on the catheter also, you can see from the catheter. Another step is comfort. After elimination, we should make sure that our patient is comfortable. So we are going to comfort. So how are we going to make our patient comfortable? One, we are going to change the soil linen and wet linen. We are going to change it, and then we are going to do oral care, bed bath, in case the patient is not able to do it. in case the patient is not able to do it. In fact, discomfort is a nursing care. And then after this, we are going to see exercise. Now, here we have two types of exercise. Passive exercise and then active exercise. Passive is when a nurse helps a patient to do the exercise. And then active is when the patient does it on its own. Then what are we going to do? We are going to encourage the patient to move and ambulate around. Also help to increase appetite. The very many important of exercise. So you make the patient to move around, or if the patient that cannot move, you take the hand and you be flexing and relaxing even the legs, so that it aids saturation very well. Also prevent, by that way can also prevent pressure sores. And then after, we are going to go to rest. After the exercise, the patient has to rest. Now, what are we going to do to prevent the patient from being disturbed? You restrict visitors. You switch off the light. In the night. Then avoid noise making. So what are the things which you do under the psychological care? One, you use what the patient like. You also involve the patients in the care, like if you are doing something, say, can you help me do this, but not the procedures. And then, if the patient like reading books, you provide them with the books, newspaper. If the patient like watching, you can also allow the patient to watch TVs, and then in those games like Ludos, like Ludos, Meso, those games there. Use what the patients like, and it does not have any bad impact on the patient. And then, after the psychological care, what do? Discharge our patient and give discharge advice. So what are the advice you are going to give our patients on discharge? 1. To finish the medication which the patient as prescribed. Also at the right hour. So to finish the medication as prescribed, also to finish the medication as prescribed also at the right hours, frequency and the time. So to finish the medication as prescribed also at the right hours, frequency and the time should be followed. And then to practice good personal hygiene. And then to eat also well-balanced diet. to come back in case of any sign of disease or if the patient is not feeling well. And then to come back for review also. Avoid harmful behaviors. So those are the advice you give to the patients on discharge. In summary, the nursing management of the patient, we start with the aim, and then we come to assessment. In the assessment, we take the history, we do our physical examination. We will examine our patient. After taking the history, we do physical examination. Then after physical examination, we will admit our patients in a clean, well-ventilated, having sufficient light. Then we position the patients according to the condition of the patients. And then we have to we will reassure our patients. This one we reassure to allay anxiety. And then we do our observation, that is temperature, blood pressure, pulse rate, respiration. That is vital signs. And then we'll do our investigation. Under investigation, we are going to do CBC-RBS urinalysis according to the conditions of the patient. Then we will give the medication as prescribed by the doctor, because you know we are not allowed to prescribe drugs. And then after the drug, we are going to do our nutritional management. We give well-balanced diet. Water also will give according to the nutrition is also according to the condition of the patient, like those of diabetics, hypertension, they have also their limitation. And then we come to elimination, where we are going to monitor the fluid intake and output, that is urine, using the fluid balance chart. And then we are going to monitor the bowel movement, that is stool and vomiters. Then after, we are going to see that our patient is comfortable. That is nursing care, that is changing the soil linen, oral care, bed bath, nail care, all those care which is supposed to be given to the patient. Then after, we are going to do exercise for our patient or help our patients to do exercise. We will advise our patients to do exercise. And then another thing, after exercise, you need to rest. We are going to make our patient to rest, restrict visitors, switching off the light at 10 p.m., avoid noise in the ward. And then after, we're going to do the psychological care for the patient. This one we use what the patient like. Then if the patient is like reading books, we'll give them books, novels, stories. And if the patient like watching, we encourage them to watch the televisions, news, depending on what the patients like. And then after, we'll plan for this, we discharge the patients and advise the patient to finish the medication as prescribed at the right time, right frequency, and then the hour. And then you have to practice the good hygiene and eat well-balanced diet. Come in case of any sickness, and then to avoid harmful behavior. Also remember to come for a review. And that is all. Thank you for watching. See you in the next one. And don't forget to subscribe if you get any value out of this video.